So we do have some updates on Lamar. Let me come over here. Sorry, the prompter's cut off right there. Damar Hamlin's condition after he collapsed during Monday night's football game. As of this taping, the Buffalo Bills player remains in a hospital after going into cardiac arrest on the field. In an interview with reporters, his uncle said that Damar was resuscitated once on the field and then again at the hospital. He has reportedly been receiving 100% oxygen from a ventilator, but now that is down to 50%. The city skyline in Cincinnati, if you see right here, also was lit up in blue as a tribute to Damar. We should also mention that Damar's Toy Drive fundraiser, which we talked about yesterday, has received more than $6 million in donations, and that's as of this taping. So for more on this, we are joined by Dr. Coley, who is also a cardiologist. So Dr. Coley, we have so many questions for you. We're so glad that you're here.
Doc, I don't know what we'd do without you today. You know, watching that game, seeing that he had to be resuscitated on the field was terrifying for all of us. But then to find out that it happened for a second time when he got to the hospital, talk to us about what that means. What do you honestly think when you hear that as a physician?
You know, it's not all that uncommon, but it did make me a little sad to hear that, because if it was only once, then whatever that initial trauma or whatever triggered that arrhythmia might have gone away. But the fact that it happened a second time, and that 2 minutes later when he was at the hospital, you know, that makes me a little more concerned. My main question is, was it the same thing that caused both arrests, which would be a little bit more ominous, that there's some underlying problem with the heart itself that is causing him to arrest repeatedly, or was it that the first arrest caused the second arrest? Because when you're down, your organs are not getting blood. It can turn your blood acidic, which can cause your heart to rest for a different reason than the initial. It's kind of a normal response of the body to not getting blood.
So his uncle also said Damar was being sedated, right, to recover. Is that normal?
So, you know, it's a thing called therapeutic hypothermia, where after somebody has a cardiac arrest, in order to protect their brain and their other organs, there's evidence that if you cool down their body to very low temperatures, you can actually sort of prevent all the inflammatory cells that are rushing in there. You can cause the blood vessels to constrict so those cells aren't going in there and causing damage. So you do that for about 24 hours.
Wow.
And then you slowly warm them up. Now, those periods when you're cooling them and warming them up are high-risk periods. And that could be that second arrest, because you're creating electrical problems in the heart, you're creating electrolyte abnormalities when you're doing all that changes in body temperature. So you could have had an arrhythmia during that cooling period if he is being cooled. But we'll really have to wait till he warms up, then they'll have to wean the sedation, then they'll do that neurological assessment to see how his brain is waking up, if he's following commands. They'll probably get an MRI at that time. Right now, they're probably not doing too much of anything. They've probably done an ultrasound on his heart. They're obviously doing blood tests and keeping a very close eye on his oxygen
So
levels.
it's not necessarily bad news that we're not hearing anything at the moment.
I would not expect to hear anything. People don't have cardiac arrest and then just wake up and start talking to us. So this is a waiting game. This is a time to rest his organs that have been injured and really see how he recovers.
Well, Damar is said to be in the prone position, meaning on his stomach. So what's the significance of that positioning?
So we do that sometimes in the intensive care unit. And do you remember with Eric, we had...
Oh, this is really... Yes, it's just a lot of the terminology that I'm listening to. Dr. Coley knows it reminds me so much of everything I heard on the daily with my brother-in-law, Eric. So I just want to say this, and then I don't want to say anything more. I pray that he makes a full recovery, and I pray that he doesn't have a long road, because it's a very difficult road for the patient and for the loved ones. Sorry.
And Sam, I've been thinking about you this whole journey as well, because you can imagine for his family to see him on his stomach in the prone position, to see him resuscitated multiple times, 24-year-old healthy football player. I mean, they're going through what Sam and her family went through. So my prayers go out to them. But we sometimes put them on their tummy because it helps to recruit more lung tissue. So remember, when we're breathing on our own, we're sucking air in, right? We take a breath, we suck in. It's a negative pressure system. When the ventilator is breathing for us, it's pushing air in. So it works by different mechanics, and it actually works better when you're on your tummy because it recruits all the back portions of our lungs that we don't normally use when we're sucking. So it brings brings all the lung tissue to help out, essentially. And we expect his lungs to be a little bit damaged with the CPR, because you can get stomach acid going into the lungs, you can get inflammation in the lungs because they didn't get oxygen. So we expect him to be on some oxygen. And to me, it was a positive sign that within 24 hours, his oxygen level went from 100 down to 50. And, when they get down to 20 or 30, that's when they can sort of start weaning a little bit. And so I'm very encouraged by all of that. I'm not discouraged that he's in the prone position. I'm just hoping we get more information about him neurologically.
Okay, I'm going to gather myself because this is an important question. I'm seeing a lot of people online saying things like this is attributed to the vaccine, and the COVID vaccine can cause these cardiac arrests. You're a cardiologist, best in the world, in my opinion. What would you say to those people?
As a cardiologist and as a physician, I would say I'm disgusted, especially because some of these people are physicians that are pushing this misinformation. And honestly, shame on them. Shame on them. And I'm embarrassed to call them my colleagues. And I think that they're a black mark on the profession of medicine because they're using it to push their political agenda, their personal agenda, to get, a platform to say whatever they want to say. And I am very confident as a cardiologist that there's absolutely no link between the COVID vaccine and what happened to Damar Hamlin, between the COVID vaccine and cardiac arrests in athletes. Now, if you got the COVID vaccine and you develop myocarditis, then yes, that can increase your risk of arrhythmias because that causes inflammation and scarring in the heart. But what the American Heart Association has actually seen over the last couple of years is that the number of heart disease-related deaths have gone up. Now, the anti-vaxxers will tell you that's because of the vaccine. No, that's because of the infection and because of the lack of access to care that people have not been able to get heart care in time. So it's actually the opposite. They're using the data, manipulating it to their advantage, and I'm really disgusted by what I'm seeing online.
Well, at least we can get to the facts with that. There's another story that's all over the news that we want to get your opinion on. We talked about it yesterday. Jeremy Renner. We're getting a first look at him after a snow plowing accident on Monday. So the actor posted this photo from his hospital bed, writing, "Thank you all for your kind words. Too messed up now to type, but I send love to you all." So we're also learning what exactly happened. Now, authorities say Jeremy was helping a family member get a car out of the snow. He got out of the plow, but the machine started to roll, and the accident happened when Jeremy tried to get back in. Wow.
So, Dr. Coley, what we just saw, that was 14,000 pounds that ran him over. And we laughed off camera that the snow has no impact on what that type of machine and how much weight that is on his leg. That's not going to help it out. What do you think his chances of recovering are?
He looks better than I expected him to look, I'll be honest, and I'm very reassured that he's posting pictures on Instagram. To me, that's a really good sign. With that kind of a crush injury to the leg, think about all the things in our legs, our muscles, our bones, our nerves, our blood vessels. You're destroying every single one of them. You're crushing the muscles, which can cause kidney damage from the chemicals they release. You could sever the arteries, which means you could hemorrhage within seconds. And in fact, a doctor, I believe, had to put a tourniquet on his leg to actually prevent him from bleeding to death, because you literally can die within minutes after an arterial injury like that. And then, of course, he may have permanent nerve damage, hopefully just the sensation and not the motor or the function. So I'm hopeful the doctors can rebuild the bones and hopefully have got the arteries connected up again if there was an arterial injury causing the blood. And now it'll be really important to see how his rehab goes and his physical therapy, but I'm hoping it doesn't affect the function of his leg. And I think he's lucky because he could have lost a leg.
Right.
This is how people lose legs in accidents.
And let me clarify what I said. We laughed earlier because I was like, Dr. Coley,
Jeff, I was about to clarify that for you.
He was in the snow. I'm like, doesn't that mean like the snow would give a little bit and it wouldn't be as harsh? And she's like, no.
Jeff,
when I said laughed about it, that's what we were laughing.
Optimist. Yes.
It's exactly what it was.
That's exactly what it was.
Yes, we wish him the best.
Dr. Coley, thank you so much for being here and answering all of our questions. You can follow Dr. Coley on Twitter at PyleColeyMD. We did want to clarify something we mentioned at the top of the show. We said Damar Hamlin's heart had to be started twice, according to his uncle. But now, according to another family representative, he only went into cardiac arrest once. And again, our thoughts and prayers are with him and his family. We'll see you tomorrow.